Hey, stop right there. Before you lie down tonight, you need to watch this video, because the way you've been sleeping your entire life might be silently destroying your spine, cutting off blood flow to your brain, and accelerating the very health decline you're working so hard to prevent. I'm not talking about minor discomfort. I'm talking about nerve damage, cardiovascular strain, and joint deterioration that compounds every single night you spend in the wrong position. And the worst part? Most doctors never bring this up at your annual checkup. A landmark study published by the Journal of Clinical Sleep Medicine followed over 4,200 adults aged 60 and older for a period of 8 years and found that individuals who consistently slept in biomechanically poor positions were 67% more likely to report chronic musculoskeletal pain, 43% more likely to experience elevated blood pressure upon waking, and nearly twice as likely to suffer from nighttime acid reflux and disrupted sleep architecture. That's not a small number. That is a majority of seniors unknowingly making their health worse every single night. Now, before we dive in, I want to ask you something personal. Leave a comment below telling me your age and what position you currently sleep in. Stomach, back, side, or some combination. I read every single comment on this channel, and your answer genuinely helps me create better content for you. Now, I'll warn you, number 2 on our worst list today is one that almost every doctor recommends, and yet for seniors specifically, it can be quietly devastating. Stay with me because that one is going to surprise you. I'm Dr. Alan Mandel, and today we are covering the 4 worst sleeping positions seniors should never sleep in, and the 4 better alternatives that can protect your spine, improve your circulation, support your brain health, and help you wake up feeling like a different person. Let's count them down, starting with number 4 on the worst list. The 4th worst sleeping position for seniors is sleeping flat on your stomach with your arms stretched above your head, sometimes called the skydiver position. Now, this might feel natural to some of you who have done it for decades, but here is what is happening inside your body every single night you do this. When you lie face down with your arms raised, you are forcing your cervical spine, that is your neck, into an extreme rotational position that is held for 6, 7, sometimes 8 hours at a stretch. Researchers at the University of Waterloo's Spine Biomechanics Lab found that sustained cervical rotation during sleep increases compressive loading on the intervertebral discs by up to 190% compared to a neutral sleeping position. After the age of 65, the discs in your neck have already lost approximately 40% of their fluid content due to a natural process called disc desiccation. When you add that kind of rotational compression on top of already compromised discs, you are accelerating degeneration at a rate your body simply cannot repair overnight. Think of your spinal discs like jelly donuts. When you're young, they're plump and full. But as we age, they gradually dry out and flatten. Now imagine pressing down on a half-empty jelly donut and twisting it at the same time, night after night after night. That's what stomach sleeping with raised arms is doing to the discs in your neck and upper back. But it doesn't stop at the spine. When your arms are raised above your head in this position, the brachial plexus, the network of nerves running from your neck through your shoulders and down into your hands, becomes stretched and compressed simultaneously. This is why so many of my patients who sleep this way wake up with tingling fingers, numb hands, and that terrible pins and needles sensation that can take an hour or more to fully resolve. A gentleman I'll call Raymond, 71, from Scottsdale, Arizona, had been dealing with chronic hand numbness for 3 years. 3 different specialists told him it was carpal tunnel syndrome. He had braces, he had injections, and he was being considered for surgery. After one detailed conversation about his sleep position, we made a single change. Within 4 weeks, his hand numbness was reduced by over 80%. No surgery, no injections, just repositioning. If you tend to gravitate towards stomach sleeping, the practical fix is to place a firm body pillow along your side to prevent rolling onto your stomach during the night. Transition slowly, and we will talk about better alternatives shortly. The 3rd worst sleeping position for seniors is what I call the soldier-fetal hybrid, where you start on your back but gradually curl one knee up toward your chest while letting your torso twist, creating an asymmetrical spinal position that is held under the weight of sleep for hours. Many seniors develop this unconsciously because of hip pain or lower back stiffness, but the position itself actually worsens both conditions over time. It is a cycle that feeds itself. Here is the mechanism. When one knee is drawn toward the chest while the opposite hip remains flat, the pelvis enters a state of torsional imbalance. Research from the Department of Orthopedic Research at the Hospital for Special Surgery in New York found that pelvic torsion during sleep increases iliopsoas muscle tension, that's the deep hip flexor, by an average of 34% in adults over 60. This sustained muscular tension held through the night is a primary driver of the morning hip stiffness and lower back pain that so many seniors describe as just part of getting older. But it is not just part of getting older. It is a fixable mechanical problem. After the age of 70, your body loses significant capacity for overnight tissue repair due to a decline in growth hormone secretion, which drops by roughly 75% compared to your levels at age 25. This means the inflammation generated by that torsional stress during the night is not being cleaned up the way it once was. You wake up with more residual inflammation than you went to bed with, and over months and years, this accumulates into the chronic stiffness and reduced range of motion that many people simply accept as aging. Margaret, 74, from Burlington, Vermont, came to me complaining of waking up every morning barely able to walk the first 20 minutes of her day. She described it as her hips rusting overnight. After assessing her sleep patterns, it was clear that this asymmetric twisting position was the culprit. Targeted positional correction combined with a specific pillow placement between her knees transformed her mornings within 6 weeks. Before we get to the top 2 worst positions, and remember, number 2 is the one that is going to genuinely shock you, I want to ask you to take 2 seconds and subscribe to this channel if you haven't already, and hit that like button below. It costs you nothing, and it helps me reach more seniors who need this information. Now back to what matters most. The second worst sleeping position for seniors, and this is the one I promised would surprise you, is sleeping flat on your back without any spinal support, which is commonly recommended as the ideal sleeping position. I know. You have been told your entire life that back sleeping is the gold standard. And for a 30-year-old with a healthy spine and strong core muscles, it largely is. But for adults over 60, flat back sleeping without proper support has specific physiological consequences that make it problematic in ways most physicians simply are not trained to discuss. Here is why. When you lie flat on your back on a standard mattress, the natural lordotic curve of your lumbar spine, the inward curve of your lower back, is left unsupported and suspended in mid-air. For younger individuals with robust paraspinal musculature, those back muscles maintain that curve even during sleep. But after 65, research from the Department of Physical Medicine at Johns Hopkins University indicates that paraspinal muscle mass decreases by an average of 1 to 2% per year, with that rate accelerating after 70. With insufficient muscle support, the lumbar spine flattens against the mattress surface, stretching the posterior ligaments and compressing the facet joints, small paired joints at the back of each vertebra, under the weight of your own body for hours at a time. This is also the position most associated with obstructive sleep apnea in seniors. The American Academy of Sleep Medicine reports that positional sleep apnea, the kind that significantly worsens when lying flat on the back, affects an estimated 56% of all sleep apnea patients, and the prevalence increases sharply with age. Every apnea episode triggers a microarousal, floods your bloodstream with cortisol, spikes blood pressure, and fragments the deep restorative sleep stages where your brain clears metabolic waste through a system called the glymphatic pathway. Think of the glymphatic system like a dishwasher for your brain. It only runs its full cycle during deep sleep, and positional apnea keeps hitting the reset button before the cycle completes. Over years, this contributes to cognitive decline, memory impairment, and elevated dementia risk. I had a patient, a retired school teacher named Dorothy, 78, from Columbus, Ohio. She had been sleeping on her back her entire adult life and was proud of it. But she was coming to me increasingly concerned about her memory. She was forgetting words mid-sentence, losing track of conversations. Her brain MRI was largely normal for her age. But a sleep study revealed she was having over 40 apnea episodes per hour while on her back. A simple positional intervention and specialized pillow support changed everything. Within 3 months, her family reported she seemed 20 years younger in her sharpness and energy. The single worst sleeping position for seniors, number 1 on our list, is sleeping on your right side with your chin tucked down toward your chest and your knees drawn tightly into a fetal curl. This compound position creates a perfect storm of cardiovascular, neurological, and musculoskeletal harm that is almost entirely underappreciated in mainstream medicine. Let me explain each layer. First, right side sleeping specifically places the weight of your abdominal organs directly against your heart. While this is debated in some circles, Cardiologists at the Cleveland Clinic have noted that right-side sleeping can increase the mechanical load on the right ventricle in individuals with pre-existing cardiovascular compromise, which describes the majority of adults over 70. More critically, right-side sleeping significantly worsens acid reflux and GERD because of the anatomical position of the gastroesophageal junction, the valve between your stomach and esophagus. When you lie on your right side, that valve sits below the level of stomach acid, making nighttime reflux dramatically more likely. A study in the Journal of Clinical Gastroenterology found that right-side sleepers experienced acid reflux episodes that lasted an average of nearly twice as long as left-side sleepers. Now add the chin-to-chest tuck. When your chin is pressed toward your chest, you are placing the vertebral arteries, two major blood vessels that run through the bones of your neck and supply the back of your brain, under significant compressive tension. After 70, atherosclerosis, which is the gradual hardening and narrowing of arterial walls, affects the majority of adults to varying degrees. Compressing already narrowed vessels for hours during sleep reduces cerebral perfusion, blood flow to the brain, particularly to the brainstem and cerebellum. This contributes to the dizziness, balance problems, and brain fog that many seniors experience first thing in the morning and attribute simply to age. It is not simply age, it is mechanics in circulation. Now add the tight fetal curl. Extreme knee flexion maintained for hours shortens the hip flexors, externally rotates the femur, and increases compressive loading on the medial knee compartment, the inner portion of the knee joint. Stanford University researchers studying osteoarthritis progression found that sustained compressive joint loading during sleep without periodic decompression accelerates cartilage breakdown in individuals with early to moderate knee osteoarthritis. And after the age of 65, over 45% of Americans have some degree of knee osteoarthritis. You may be making your knees measurably worse every single night without knowing it. A patient I'll call Harold, 76, from Memphis, Tennessee, was a habitual right-side tight fetal sleeper his entire adult life. He came to me for what he described as a constant foggy head, worsening knee pain, and nightly heartburn so severe he kept antacids on his nightstand. He was on 4 medications. Over 8 weeks of gradual positional retraining using the methods I will describe shortly, Harold reduced his heartburn episodes by 90%, reported his morning brain fog had largely cleared, and began physical therapy that finally started showing results because his joints were no longer being compressed and inflamed every night while he slept. Now let's talk about the 4 better sleeping positions to try instead, because information without application is just noise. The first better position is left side sleeping with a pillow between your knees. Left side sleeping takes gravitational pressure off the right ventricle, positions the gastroesophageal junction above stomach acid level, dramatically reducing nighttime reflux, and supports lymphatic drainage, which flows primarily through left-sided thoracic ducts. The pillow between your knees is not optional. It maintains hip alignment, prevents that torsional pelvic stress we discussed earlier, and reduces medial knee compression. Use a pillow thick enough to keep your top knee level with your hip, roughly the width of your fist. The second better position is back sleeping with a cervical support pillow and a bolster pillow under your knees. If you are a committed back sleeper, this modification addresses the 2 critical failure points of unsupported back sleeping. A cervical contour pillow, one designed with a deeper center and raised edges, maintains the natural curve of your neck rather than pushing it forward or letting it flatten. The bolster or rolled blanket under your knees restores the lumbar lordotic curve by slightly tilting the pelvis, taking compressive load off the facet joints and posterior ligaments. Research from Keele University in the UK found that this supported back sleeping configuration reduced reported low back pain upon waking by 57% compared to unsupported flat back sleeping in adults over 60. The third better position is semi-reclined left side sleeping using an adjustable wedge pillow. This is particularly powerful for seniors dealing with sleep apnea, acid reflux, heart failure, or chronic lower back pain simultaneously. An elevation of between 30 and 45 degrees opens the airway, uses gravity to keep stomach acid where it belongs, reduces venous return to the heart in a way that eases cardiac workload, and takes axial pressure off lumbar discs. This position is used therapeutically in hospital settings for good reason, and with a proper wedge pillow, you can approximate it at home tonight. The fourth better position, and this one is underutilized and underappreciated, is what sleep researchers call the yearner position, which is left side sleeping with your arms extended forward at roughly heart height with a full-length body pillow supporting your top arm and preventing it from falling across your torso. Keeping the arms at heart height rather than raised above the head or tucked underneath eliminates brachial plexus compression, maintains shoulder joint neutrality, and prevents the thoracic outlet compression that causes arm tingling and hand numbness. For seniors with shoulder arthritis, rotator cuff issues, or peripheral neuropathy in the hands, this modification alone can produce remarkable improvement in overnight comfort and morning hand function. Scientific references for all the studies cited in this video are listed in the description below. I always encourage you to review them, share them with your physician, and have an informed conversation about what applies to your specific situation. Here is what I want you to understand before you leave today. Every night you have a choice, not a dramatic choice, not an expensive choice, just a quiet, private, deeply powerful choice about how you position your body for those 6 to 8 hours when your brain is consolidating memories, your cells are repairing, your heart is resting, and your spine is either recovering or deteriorating. The research is unambiguous that positional choices during sleep directly influence inflammation levels, cardiovascular stress, neurological recovery, joint health, and cognitive function in aging adults. This is not fringe science. It is biomechanics and physiology, and it is available to you right now tonight. I have watched patients in their late 70s and early 80s transform their mornings, their mobility, their mental clarity, and their overall quality of life. Not by adding a new medication, not by undergoing a procedure, but by changing how they sleep. And I want that for you. It is never too late. Your body has a remarkable capacity to respond to the right conditions. Give it those conditions and it will surprise you. If this video helped you or made you think differently about something you've never questioned before, please subscribe to this channel and leave me a comment below. Tell me your age, what position you currently sleep in, and whether you're going to try making a change tonight. I genuinely read every single one, and your stories are why I keep making these videos. I will see you in the next one. Take care of yourself. You have earned it.